breaking news. In just the past few minutes came word that President Obama has declared the H1N1 flu outbreak to be a national emergency. In just released documents, the president finds that the rapid increase of illness may overburden health care resources and that certain federal requirements may now be waived. We're working our way through the language to determine the breadth of the waivers. We'll also give you the latest on the H1N1 vaccine shortage. Capital starts right now. This is a Fox News alert. We begin with breaking news. President Obama has now declared the H1N1 virus to be a national emergency. 46 states now have widespread problems with the H1N1 virus, and as the number of confirmed cases rises, so does the demand and the lines for the vaccine, and there isn't enough to go around. Caroline Shively is here in Washington with more on that story. Hello, Caroline.
Hello to you, Brian. In this emergency declaration, the president wrote that the potential exists for the pandemic to overburden healthcare resources in some areas. That declaration reads in part, quote, "The temporary waiver of certain standard federal requirements may be warranted in order to enable U.S. healthcare facilities to implement emergency operations plans." Now, by making this declaration, the government could temporarily do away with certain requirements of Medicare, Medicaid, and other federal requirements to handle the emergency response. This declaration comes as local jurisdictions and doctors are struggling to find enough of the vaccines. Fairfax County, Virginia got a batch of 10,000 doses of the H1N1 vaccine. That is the mother load. Many doctors' offices have only gotten several hundred and run out quickly. Fairfax County officials were swamped today, as you can see. Like most places, they prioritized who could get the vaccine: children 6 months to 3 years old and pregnant women. Some of the people here had been standing in line since last night.
My pediatrician is all out of the regular flu, and so I don't think we'll get any of the swine flu, the H1N1. So I'm just really concerned about with the effect on babies and young kids. So definitely want to get them vaccinated.
The latest CDC surveillance report of the H1N1 shows you how hard the nation's been hit. It marks widespread activity in all but 4 states. South Carolina, New Jersey, and Connecticut show only regional activity. D.C. and Hawaii local. More than 1,000 people have died from H1N1, including nearly 100 children. Brian?
All right, Caroline, thank you very much. Let me just take a moment, if I could, to sort of explain what this declaration that the president has just given us is all about, as best we can determine it. According to the press release that came out just a few moments ago from the White House, the proclamation signed by the president late last night enhances the ability of our nation's medical treatment facilities to handle a surge in H1N1 patients by allowing, as needed, the waiver of certain federal requirements on a case-by-case basis. We are trying to determine what the breadth of that is, what these waivers might entail. So stay with us as we try to work through all the legal language on this developing story. Again, the president has declared that the H1N1 flu virus outbreak is a national emergency. Let's turn now to get more on this with Dr. Lee Vanoker, who knows a little bit about the problems that we've been having with the H1N1 vaccine. Dr. Vanoker, the government's been good on us to get this vaccine, and we're not able to find it, and so many people are being turned away.
Yeah, well, it's true, because the truth is the virus didn't let up. It went all the way from the summer until now, and now it's picking up speed. It's not getting more virulent, but it's really spreading like wildfire. And they've been starting to make the vaccine, but the problem is you have to grow it. You have to grow the virus in chicken eggs. Then you kill it or you inactivate it. When it's inactivated, you make the nasal spray. When you kill it, you make the injectable. And it only grows so fast. I mean, you can't do it. And they haven't had a break. And right now, I mean, it's like the peak of flu season last year for the regular virus.
So that's the sort of telling thing here, is it's not even close to the peak of season. And already this thing is sort of getting explosive.
Well, it is. And the point is, this is now all H1N1. What's going to happen when the other flu viruses start coming in and we get the seasonal flu? You know, it's just going to be more people getting sick and a little bit more confusing. Well, did you really have the H1N1? But most of the activity is H1N1 now. And we're doing a good job of getting the message out, get the vaccine, but the problem is there is no vaccine.
So Dr. Vanoker,
a quarter of what they promised has been out.
the bottom line is that for the vast majority of people who get the H1N1, it's just a mild flu.
Right.
But the fact of the matter is, for a lot of people, a small minority of people, it can get bad
Less
quick.
than 1%,
Right.
It can be serious disease and cause fatalities. But the problem is, if we're not going to have enough vaccine till mid-November, and almost everyone's going to have been getting it and getting exposed as it ramps up, there are going to be fatalities. And the sad part about it is, just from a numbers perspective, but the sad part is 60% of the people that are getting sick are under 18, so you're talking about fatalities in kids.
And the supply, will it get better quick, or is it going to be a little while?
Well, it's hopefully they're starting to ramp up. They didn't realize they were going to need so much and it was going to spread. So they're predicting now, I sat on the CDC conference, and they're predicting by mid-November they should have better amounts. But you know, the 5 target groups is about 159 million people.
Wow,
And those are the
yeah.
target groups. They're not just saying anyone who wants one, like you or me.
All right. We're going to ask you to stick around because this
Absolutely.
seems to be a developing story this hour, and we're going to need your expertise as we go forward. Let me just recap very quickly. In the last few minutes, we have learned that late last night, the President signed an emergency declaration saying that the H1N1 flu virus has now reached the status of a national emergency. And by doing this, by signing this proclamation, he is basically waiving certain federal standard requirements on a case-by-case basis. That is the language that we are burrowing in on right now. Now, some of this seems to be just clearing some red tape to make sure that when the vaccine is available, it can be easily administered to a large number of people. But a lot of this other stuff could be other things that we're trying to track down. Stay with us as we continue to plow through what this truly means. And we're tracking the latest H1N1 news here on Fox. Log on to foxnews.com and be sure to check out the new H1N1 vaccine map. It has important information on the vaccine where you live. Healthcare reform might be even